Hi, I am Dr. Felice Gersh, your integrative OBGYN. And for this Instagram Live, I'm going to talk about what is really an important topic. It comes up in my practice with my patients all the time, and I get emails by the truckload from people out there throughout the country and even the world asking me this question. I am over 60. I've been in menopause for a number of years. It could be quite variable, but I'm over 60. Is it too late for me? I hear over and over that going on hormones, hormone replacement therapy, even with human bioidentical estradiol and progesterone, is harmful. And so, what do I do? Well, let's go back and think, where did this idea even come from? That if you are more than 10 years out from the menopause, which, just to remind you, the definition of menopause is a created definition, not in nature, by a group of doctors somewhere along the line. So it's by definition 12 consecutive months without any vaginal bleeding. So what does that mean? Well, by that, it means that you're at the end stage of the transformation known as the perimenopause into menopause, which is not about periods. It's about ovarian aging or ovarian senescence and the decline in the ability of the ovaries to make estradiol, the estrogen that's made by the reproductive aged ovaries, post reproductive capability. The ovaries make no estrogen of any form, and estradiol is the estrogen that the ovaries make when they are able to, and progesterone. So the reality is that the notion that if you are more than 10 years from the last menstrual period, and remember, this is a made-up definition. Again, it's not about periods. Remember, a woman who has a hysterectomy still goes through menopause. It's about loss of these vital life hormones. And it's manifested in a number of ways, one of which is alteration in the menstrual cycles and eventually the end of the menstrual cycle. But there are varying effects in every organ system with the decline and subsequent loss of the production of estradiol and progesterone. So, where did this idea come from? That if you are more than 10 years out or the age of 60, whichever came first, 10 years since the last period or age 60, then it's too late, you're too old, it's too dangerous. So where did that come from? Well, it came from that unfortunate study. Meant well, did not deliver anything useful for treating women in menopause. There were some other useful offshoots, but not the basic premise, which was, is it safe or not safe and beneficial or not beneficial for the cardiovascular system? That was the prime directive of that study. Well, the bottom line is, what did they use in the study? The end result of the study is based on the interpretation of what happened with what they used in the study. In the Women's Health Initiative study that ended over 20 years ago, and the beginning stages of it was back 30 years ago, they used in that study conjugated equine estrogen given orally. So what does that mean? Conjugated means it's gone through the liver through a process of transformation or detoxification so that it can be transformed from fat to water soluble, so it could go out with the water, the urine, out through the kidneys and the bladder. So that is what conjugated means. It's a liver transformational process. Equine, what does that mean? It means horse. So it was the urine from a pregnant horse, a mare. And they took this urine product, which contained a whole conglomeration of all sorts of estrogen metabolites and a bunch of other junk that's included in it. They made it into a tablet. And then they added another substance, medroxyprogesterone acetate. Now, it sounds like progesterone because it has the name progesterone in it, but it is not. It is progesterone that's modified, so it's medroxyprogesterone acetate. Even though it has the word progesterone, it is not the same as the progesterone made by the ovaries. It doesn't take a lot, it can take very little to change a molecular structure, to have very different effects in the body. Let me give you one example. Water. Water is H2O, right? 2 hydrogens, 1 oxygen. Well, what if you add just one little oxygen? Now you have H2O2. That's hydrogen peroxide. You might on a hot day like a nice glass of water, H2O, but you don't want to drink a glass of hydrogen peroxide. So even though MPA, medroxyprogesterone acetate, sounds like progesterone, it's not progesterone, okay? It has different effects in the body. In that study, they wanted to use women who had no symptoms because they didn't want women to know from what they were taking if it was a placebo or the real pill having the hormonal medication in it. I use the word hormones because that's what's used, but they're really endocrine disruptors for the human. They're not hormones ever found in a human female, and so they're foreign. So they're actually estrogen and progesterone endocrine disruptors. They affect the receptors and the production differently than if you gave human bioidentical hormones. So in this study, well-meant, well-intentioned, they used these chemicals that would never be found in a human. And because they didn't want to give it to women who had symptoms, they could figure out which group they were in, because if they had hot flashes, they would get better. And then they'd say, oh, I'm in the real treatment group. Well, they figured it out anyway, because the women had a lot of breast tenderness and bleeding. So it was not very blinded after all. But that was the intent. So, but in any case, to try to get women who didn't have symptoms, they used women who were quite far out from the advent of their menopause. The average age was 63. It went all the way up to 79. These women had a lot of health problems. Many of them had high blood pressure and they had atherosclerosis. They had metabolic problems. They were a sampling of average American women, average age 63 up to the age of 79. Well, when you give this particular chemical to older women, there are some significant risks that could happen. The main one was that the conjugated equine estrogens, what did they do? They increased dramatically the risk of blood clots, more so than birth control pills, because it goes into the bloodstream as hormones that would not be the same as coming from the ovary. Predominantly these horse estrogens, never found in a human, and when they were converted, they went into estrone. Estrone is an estrogen that has a different effect on receptors, predominantly on one, the alpha receptor, whereas estradiol, a different estrogen, has a balanced effect on all the estrogen receptors. Remember, if you've been following me, estrogen is not a hormone. It's a family of hormones. So they have different actions, just like B vitamins and fats don't have the same action when they're a different member of the family. So they did this study. They found that it dramatically increased the risk of clotting. Well, if you take a woman who already is not very healthy, maybe has plaque, high blood pressure, and then you give her something that increases blood clots, she's more likely to have something like a blood clot. And that could be ending up causing a stroke or a blood clot in the leg that could go to the lungs, like a pulmonary embolus. Now, the risk was surprisingly not as high as you would guess, but it was definitely statistically significant. Now, the medroxyprogesterone acetate, it turned out, increased the risk of breast cancer, but not the conjugated equine estrogen. When they broke it apart and they had a smaller group of women who were only on the conjugated equine estrogens because they had a hysterectomy and they didn't know any better, so they didn't think that they needed progesterone, although they weren't using progesterone, they were using that chemical substitute. But in that group, they had a lower incidence of breast cancer. So the breast cancer increase, which was relatively small, but about statistically significant, was not due to the estrogen component. It was due to the progestin, the fake progesterone component. And putting that together and then reanalyzing the data, it was very apparent that the risk was really very different than from what they first presented, but there was some risk, but it applied to those women in that age group who were taking that particular molecule, the compound that was given, the conjugated equine estrogens, and the medroxyprogesterone acetate. Based on that, all of this thinking that hormones are bad, don't give hormones, they translated data that applied only to what they studied to every kind of hormone out there in the universe, including our beloved estradiol and progesterone. That is insane. I hate to say it, that's pretty negative sounding, but you don't do a study with one thing and then apply the conclusion from that study to something that's totally different, okay? That is not really scientific method. So based on that, they said, don't give hormones to older women. Don't start them on older women because there's risk. Well, I wouldn't start those hormones on any woman, not at any age. But let's think about a different study. It also used the wrong hormones, but it wasn't as bad. It was the ELITE study. Now, in that study, they took women less than 6 years from the onset of menopause or over 10 years since they had menopause. So they either were under 6 years since their last period or over 10 years since their last period. And then they gave them 1 milligram of estradiol. So it's estradiol E2, but they gave it as a pill. Now, when you give it as a pill, it goes through the liver and it gets transformed into estrone, not estradiol anymore. So it doesn't go into the blood as estradiol. It goes in as estrone, even though it goes into the mouth as estradiol. And then they gave some progesterone with it. And what did they find in this study? Even though they were using the wrong form of estrogen, they were giving it in a very small dose and orally. They found that in the younger women, under 6 years since their last period, guess what? They actually had benefit when they looked at the carotid artery. So it was protective. Now, when they looked at the women who were at least 10 years out since their last period, then guess what they found? No harm. So they did not find that degree of benefit, but they found no harm. But remember, keep in mind, they used the wrong estrogen, and it matters because results are due to what you use. But they didn't find any harm. So that's like 2 thumbs up for that particular conclusion. And what about if you use true bioidentical hormones given properly, where the estradiol is given through the skin transdermally, so it gets into the blood as estradiol? Well, we don't have any long-term studies, but we do have evidence. We don't have long-term studies in humans because nobody's doing them, not because the results came back bad. But what we do know is that receptors don't completely die. We know that it's much better to start the hormones early. I'm pro-hormone to start in the perimenopause because the onset of hormonal change is over a long time, like 10 years before that last period, while things are changing. Negative things are happening in the body. So it's a hormone insufficiency, then it goes to a severe hormone deficiency. So you should start early. But what can you do if you're already over 60? Well, if you look at the vaginal tissue, it is totally emphasized in the North American Menopause Society and throughout the OBGYN world that you're never too old to start vaginal estrogen treatment. Guess what happens if you give vaginal estrogen as a suppository, a ring, or cream to a 75-year-old, 80-year-old woman. She's been in menopause for decades even. What happens to her vaginal tissues? They improve. They get better. So why would I think that only the vagina can respond years and years later? That is irrational. There's nothing unique about the vaginal tissues. They have estrogen receptors. So that means that they don't just die and disappear. Estrogen receptors need to be, like we'll say, supported and nurtured. And over time, they will come back at least to a significant degree. I'm not saying you can reverse time, you can change everything. It's better to start early. But what else have we seen? There's published data showing that if you put estradiol on the skin, in just 2 weeks, you'll see a reduction of wrinkles. That means you're improving all the different components of skin with estradiol, and this could be at any age. The skin receptors are still capable of responding. So there is no evidence that you will have harm from starting estrogen at any age. Do I have proof? I don't have proof I don't have the study. And every woman has to decide for herself. I would never give you medical advice on an Instagram Live. I just want to give you some information about what we have and the limit of the information as well. Because we can't turn the clock back. If you're over 60, I can't make you 50 or 40. So going on hormones from the Women's Health Initiative, which was a totally flawed study, it did show that women who started late had seriously beneficial effects on their bone, reduced fractures, and on their colon. They had less colon cancer. So we know benefits are there. If the bone can respond, and the colon can respond, and the vaginal tissue can respond, and the skin can respond at any age to the initiation of hormones, why would I think that it's a bad thing to do? And I have the ELITE study showing no harm, even with the wrong hormones and doses used. So my feeling is it's okay. Can I prove it? I can't prove it. But I have rationale, I have data looking at what we do have, and every woman has to speak to her own physician. Every woman has to decide, is she willing to take something that has no long-term clinical study to show that it is beneficial for her arteries, her heart, her brain. But we do have many doctors who are using it for cognitive benefit at any age. We have studies showing that hormones still work in a variety of ways at any age. I cannot prove it will benefit you individually. I can't prove anything. But I can tell you my feelings and what I believe based on the data that I have available to me, which of course I wish it were more, but it is reasonable. That's what we have to do. And in my forensic medical practice, as a medical expert, I'm always put on the witness stand, and what do I have to say? I have to say, is this more medically probable than not? That's the legal phrase that I have to use. Is this more medically probable than something else? So in my belief, it is more medically probable that starting hormones, as a general statement, I'm not talking about you, as just a general statement, it is more medically probable than not that going on hormones at 10 years or more or over 60 is still going to have more benefits than any harms. No proof, but medical probability. I am not relying on treating my patients solely based on the Women's Health Initiative study with its flawed reputation, its flawed interpretation, and the use of hormones that no reasonable doctor would ever use on their patients today. So I hope that gives you some information. Don't make medical decisions based on my Instagram live. Be sure you consult with your doctor. You have your own unique story. Make sure that you get good medical advice before you make any decisions concerning yourself. Good luck.